Diarrhea. The following are important points that we would like to talk about in the next few minutes. Diarrhea is described as loose, watery stools that may start a few days after treatment. Let your cancer care team know if you are taking laxatives, stool softeners, or any other medicine for constipation. Buy Loperamide, also known as Imodium, at a pharmacy and use as directed by your cancer care team should you develop diarrhea. If you are taking medicine for diarrhea such as Loperamide and your diarrhea is not controlled within 24 hours, please go to the emergency. With your cancer treatment, there will be a risk for diarrhea. Diarrhea is defined as having watery, loose stools or bowel movements, having many bowel movements in one day, or more often than before your treatment. You may also have stomach cramps, bloating, or pain. Diarrhea caused by your cancer medications usually does not start right away. It may appear 4 or 5 days after you have received your cancer treatment and last several days. Take a look at your prescription medications and over-the-counter medications. Are you taking laxatives or stool softeners? These medications may need to be stopped. Consult your cancer care team about them. The anti-diarrhea medication that is usually recommended to treat diarrhea caused by cancer medications is called Loperamide, commonly known as Imodium. It is available without a prescription at the pharmacy. Make sure you have some Loperamide available before you develop diarrhea. You should start taking Loperamide as instructed by your cancer care team as soon as you begin to experience diarrhea. The Loperamide usually comes as a 2 mg tablet. Start by taking 2 of these tablets right away after your first loose stool. That may be enough to stop the diarrhea. If the diarrhea continues, take an additional tablet after each loose stool until the diarrhea stops. The maximum number of tablets that you can take is 8 in a day. Do not take Loperamide if you think your diarrhea is caused by something other than your cancer therapy, such as food poisoning or a stomach infection. There are several other things you can do to try to reduce the effects of having diarrhea. Drinking more fluids can help you feel better and prevent you from becoming dehydrated. Try to drink 6 to 8 cups of fluids a day. Good fluid choices are water, flavored water, clear juices, soups, and jello. Sports drinks such as Gatorade or Powerade are also okay, but they should not be your only source of fluids. They contain lots of sugar, which can sometimes make diarrhea worse if you drink large amounts of it. You may find that eating small meals more frequently will be more comforting than eating 2 or 3 regular meals when you have diarrhea. Choose foods such as white bread and pasta, refined cereals, rice, potatoes, applesauce, apples, and bananas. The following are foods and drinks to limit when you have diarrhea, as they can make you feel worse. Caffeine-containing fluids, such as coffee, teas, or colas. Food or drinks with artificial sweeteners, such as sugar-free gum, sugar-free drinks, or sugar-free candies. Alcoholic drinks, fried greasy foods, sour, acidic, or spicy foods, high-fiber foods such as whole wheat, bran, fruit skins, nuts, seeds, peas, and beans, and dairy products such as milk and cheese. If at any time you experience the following, please go to the emergency right away. Your stool is black in color or contains blood. You develop fever with your diarrhea. You don't have urine or have little urine. You feel tired, weak, or dizzy. You have been taking medications to treat diarrhea for more than 24 hours and it still isn't controlled. To summarize, diarrhea is described as loose, watery stools that may start a few days after treatment. Let your cancer care team know if you are taking laxatives, stool softeners, or any other medicine for constipation. Buy Loperamide, also known as Imodium, at a pharmacy and use as directed by your cancer care team. If you are taking medicine for diarrhea such as Loperamide and your diarrhea is not controlled in 24 hours, please go to the emergency.